That bill being considered in Madison would ban abortions after 20 weeks of pregnancy.
Dozens testified at a public hearing today, both for and against the bill. News 8's Brittany Schmidt joins us now to explain.
Megan, Lisa, the authors of the bill argue unborn fetuses can feel pain at 20 weeks. That is why they want to prohibit abortions past that date. But those opposed believe it will endanger the care given to pregnant women and their unborn child. State lawmakers spent more than 5 hours Tuesday listening to testimony about a new bill that would ban abortions after 20 weeks.
I urge you to pass this bill on behalf of women, both born and unborn.
Should a woman be forced to carry a fetus who has no brain? What about a fetus with no kidneys? That the best neonatal program in the country for this condition said there's nothing that can be done to save this fetus.
One of the main points of discussion at the public hearing included the 20-week deadline. In the bill, the term post-fertilization is used as a measurement, which is based on a 38-week pregnancy. However, most doctors are used to a 40-week measurement.
The due date traditionally was based on approximately 273 days from the last menstrual period. Even if we know how far along somebody is based on, say, artificial fertilization, say, insemination, we still base how many weeks they are on when that last menstrual period would have been, or about 2 weeks before fertilization.
Leaving some state lawmakers to wonder how precise the measurement would be.
Is there an opportunity to actually determine when somebody was fertilized?
Another point of discussion surrounds the exemptions in the bill. As written, the bill would pertain to all pregnancies, including those caused by rape or incest. The only exception is in the case of a medical emergency, but it's not clearly defined. It would be left to the doctor to decide, something some lawmakers are weary about.
As a doctor, are you afraid that you're not going to be able to make a determination if it's a medical emergency and appropriate document that?
Under the proposed bill, doctors, if convicted of performing an abortion after 20 weeks, could face up to a $10,000 fine and up to 3.5 years in prison.
There are many things my colleagues and I do well, but quite frankly, predicting the future isn't one of them. If I knew somebody was going to die, I would do everything different than what I'm doing. But I don't know that. Nobody knows that. So they're putting us in a very difficult situation and putting mothers' lives at risk.
With the budget a top priority at the state capitol right now, one senator even asked the authors of the bill if this is their attempt to pass a bill under the radar because everyone is so preoccupied with the budget. However, Senator Lozick says it was not her intent. The bill was finally ready and she would like to see it passed before the end of June.
Thank you, Brittany. The Senate Committee on Health and Human Services is expected to vote on the bill Thursday. If passed, Governor Scott Walker says he will sign the bill into law.